afternoon, sir. Good afternoon, classmates. Today, our team will going to present our report, and our number one reporter is Mr. Armar Favela. And the title of his report is The Beginning of Life, and followed by me. My report is about the threats for pregnancy, and our third reporter is Miss Melanie Cayanong and Miss Christine Joy Salazar, and the report is all about the stages of pregnancy, and our last reporter is Miss Marianne Fahel. And the title of her report is Factors Affecting Development. And thank you.
Morning, everyone. Our report is all about prenatal development. The fertilized ovum becomes an embryo, develops into fetus, and develops into childbirth. This one is an egg cell, a sperm cell, female reproductive system. First, the uterus. Uterus or the mattress or the bahay bata. Uterus is an hollow muscular organ located in the female pelvis between the bladder and the rectum. Once the egg has left the ovary, it can be fertilized and implant itself in the lining of the uterus. The main function of the uterus is to nourish the developing fetus prior to birth. Next one is the fallopian tube. The uterine tube, also known as oviducts or fallopian tubes, are the female structures that transport the ova. Ova means a female gamete from the ovary to the uterus each month. In the presence of sperm and fertilization, the uterine tubes transport the fertilized egg to the uterus for implantation. Next one is the ovary. It's an organ found in the female reproductive system that produces an ovum when released. This travels down the fallopian tube into the uterus where it may become fertilized by a sperm. Next is the cervix. The cervix is a cylinder-shaped neck of tissue that connects the
Miscarriage or spontaneous abortion is an event that results in the loss of a fetus before 20 weeks of pregnancy. It is typically happens during the first trimester or first 3 months of the pregnancy. Miscarriage can happen for a variety of medical reasons, many of which aren't within a person's control. But knowing the risk factors, signs, and causes can help you to better understand the event and get any support or treatment you may need. The symptoms of miscarriage vary depending on your stage of pregnancy. In some cases, it happens so quickly that you may not even know you're pregnant before you miscarry. Here are some that Here are some of the symptoms of miscarriage. Number 1, heavy spotting, vaginal bleeding, discharge of tissue or fluid from your vagina, severe abdominal pain or cramping, mild to severe back pain. While there are some things that increase the risk of miscarriage, generally it isn't a result of something that you didn't or you did do if you're having difficulty maintaining pregnancy. During pregnancy, your body supplies hormones and nutrients to your developing fetus. This helps your fetus grow. Most first trimester miscarriages happen because the fetus doesn't develop normally. There are different factors that can cause this. Genetic or chromosomes issues. Chromosomes hold genes in a developing fetus. One set of chromosomes is contributed by the mother and another by father. Example of these chromosome abnormalities include intrauterine fetal demise. The embryo forms but stops developing before you see or feel symptoms of pregnancy loss. Dilated ovum, no embryo forms at all. Molar pregnancy, both sets of chromosomes come from the father. No fetal development occurs. Partial molar pregnancy, the mother's chromosomes remain, but the father has also provided two sets of chromosomes. Errors can also occur randomly when the cells of the embryo divide or due to a damaged egg or sperm cell. Problems with the placenta can also lead to a miscarriage. And also the lifestyle habits that we have. Various underlying health conditions and lifestyle habits may also interfere with the development of a fetus. Exercise and sexual intercourse rather, sorry, do not cause miscarriages. Working won't affect the fetus either unless you are exposed to a harmful chemicals or radiation like X-ray machine. Conditions that can interfere with fetus development include poor diet or malnutrition, drug and alcohol use, advanced maternal age, or matanda na talaga tayo, syempre, mahirap na magbuntis, parang ganon. Untreated thyroid diseases, issues with hormones, uncontrolled diabetes, type 1 and type 2, infections, if you have a UTI, yan kasi pag buntis mahilig sa mga maalat, mga chichorya, something ganyan-ganyan. So, dapat iwas-iwas muna ganun. Trauma, and obesity, yan, sobrang katakawan naman ng food, charot. Yan, sobrang taba natin, parang gano'n. And also, problems with the cervix, abnormally shaped uterus, and severe high blood pressure and food poisoning, and certain medication. Ayan, kung mahilig tayo magpaganda, tapos take ng gamot, like mga glota, ganyan. Hindi natin know na freaky pala tayo. So, ayun, magkakaroon tayo ng miscarriages. Now, let's go to our second topic, the ectopic pregnancy. Pregnancy begins with a fertilized egg. Normally, the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grow outside the main cavity of the uterus. Mostly, Ectopic pregnancy occurs in a fallopian tube which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a joval pregnancy. Sometimes, an ectopic pregnancy occurs in other areas of the body such as the ovary, abdominal cavity, or the lower part of the uterus, cervix, which connects to the vagina. An ectopic pregnancy can proceed normally, the fertilized egg can survive, and the growing tissue may cause life-threatening bleeding if left untreated. So, for the symptoms, you may not notice any symptoms at first. However, some women who have an ectopic pregnancy have the usual early sign or symptoms of pregnancy. A missed period, breast tenderness, and nausea. But if you take a pregnancy test, the result will be positive. Still, an ectopic pregnancy can continue as normal. As the fertilized egg grows in the improper place, signs and the symptoms become more noticeable. So, here are some early warning of ectopic pregnancy. First warning sign of an ectopic pregnancy are light vaginal bleeding and pelvic pain. If blood leaks from the fallopian tube, you may feel shoulder pain or an yours to have a bowel movement. Your specific symptoms depend on where the blood collects and which nerves are irritated. Complication associated during pregnancy. Most pregnancies occur without complications. However, some women who are pregnant will experience complications that can involve their health and also their baby's health, or both. Sometimes, diseases or conditions that mother had before she became pregnant can lead to complications during pregnancy. Some complications occur during the even with complication, early detection and prenatal care can reduce any further to risk to you and your baby. So ayun, kailangan pala natin mag-prenatal kapag freaky like me. Some of the most common complications of pregnancy include high blood pressure, gestational diabetes, preeclampsia, preterm labor, a loss of pregnancy or miscarriage. So hive infection, sexually transmitted diseases including HIV, kidney problems, epilepsy, anemia. Other factors that may increase your risk for complications include, so ayun nga, being pregnant at the age of 35 or older, being pregnant at a young age, having an eating disorder like anorexia, smoking cigarettes, using illegal drugs, drinking alcohol, having a history of pregnancy loss, preterm birth, or carrying multiples such as twins or triplets. The normal symptoms of pregnancy and the symptoms of complication are sometimes hard to distinguish. Although many problems are mild and don't progress, you should always contact your doctor if you have any concerns. During your pregnancy, most pregnancy complications are manageable with proper treatment. Bleeding. During pregnancy, you may experience some normal spotting within the first 6 to 12 days after you conceive as the fertilized egg implants itself in the lining of the uterus. Some women don't realize they are pregnant because they mistake this bleeding for a light period. Usually, the bleeding is very light and lasts from a few hours to a few days. Other symptoms of molar pregnancy are severe nausea and vomiting and rapid enlargement of the uterus. Additional causes of bleeding in early pregnancy also cervical changes during pregnancy, extra blood flows to the cervix, intercourse or pap test which cause contact with the cervix can trigger bleeding. This type of bleeding isn't cause for concern. Any infection of the cervix, vagina, or a sexually transmitted infection such as chlamydia, gonorrhea, or herpes can cause bleeding in the first trimester. Abnormal bleeding in the late pregnancy may more be serious because it can signal a problem with the mother or a baby. So call your doctor immediately, or sometimes placenta previa. So I experienced that placenta previa because my first baby is a placenta previa. So ayun, I'm so lucky that my friend brought me in the hospital. So ayun nga, pag buntis tayo, maging concern tayo sa ating self, hindi lang sa ating self, kundi sa baby sa ating womb. Give love, ika nga, kasi nga ang baby is a blessing. Okay, so sana may nagtulong kayo, may napulot, and maraming salamat po sa pakikinig. Thank you, and God bless us all.